they actually say that it's self-limiting? Those are words that doctors would use?
Yeah. So that's like the quotable phrase. So I can't remember. I think this was Eli Lilly. So Eli Lilly, there's been a lot of drug withdrawal controversies with the SSRIs since their inception. I think the first big thing came up in the 90s, and then again I think in the mid 2000s, people were worried about drug withdrawal. And so Eli Lilly convenes like a group of experts. I think it's led by Alan Schatzberg, who is a very famous psychiatrist. They get together, all of their buddies. These are all high-ranking professors who run clinical trials, and they put out a position paper where they analyzed withdrawal for people who came off the drugs after the clinical trials. And they said, in our perspective, withdrawal is mild and self-limiting. Now, self-limiting means it usually goes away in a couple of weeks. Now, they bury the fact that their experience comes from the clinical trials that we used to get the drugs onto the market, which were 3 months long. And so no shit, it's going to be mild and self-limiting if the brain has only had 3 months to adapt to the drug. And so again, as happens with, with good marketing and the sales department of these companies, they give this position paper that has an authorship line to die for. These are the people who run psychiatry in America. And they just hand it out to family medicine doctors and psychiatrists and say, oh, look here, Alan Schatzberg says it's mild and self-limiting. Don't worry about it. So, yeah, most doctors do think that withdrawal is mild and it goes away quickly from this essentially fraudulent, misleading claim from really bogus data that should not have been able to support that statement.